Hello, I'm Dr. John Kruse, and today I'm deviating a little bit by talking about something in the political realm. I'm going to try to keep it a scientific and an ethical perspective, and I'll get into that. So the topic for today is what the Biden-Trump debate reveals about both of their mental health. As usual, I'll be talking for about 25, 35 minutes, somewhere in there. I'll be open for questions after that. This video may therefore be considerably longer than 25 minutes, depending on how many questions there are. And as usual, I will start with the take-home message. So the take-home message is that there was a June 27th, just less than a week ago, 90-minute debate between Joe Biden and Donald Trump. And yes, this was just one short snapshot in time. We do have context from multiple media exposures of both gentlemen this year and extensive record from the past. So I'm going to discuss what we know from this debate itself and what we can surmise or suspect from it. So the take-home message again is that both men are displaying decrements in verbal ability and other signs that is in excess of what we'd expect from healthy aging. We'll get into whether we can say either one of them have dementia or not. Second point, both men continue to meet criteria for ADHD, and they've met criteria in the past. That is a statement that as long as you accept what the definition is, they fit it, and I will be transparent and discuss that. Third point, Trump does take stimulant medication to enhance his performances. I will get into the facts and evidence supporting that assertion, which I believe to be a true statement because there are no other valid explanations for his appearance and behavior. Point 4, I'm seeing a little discussion of this coming up recently, but I don't see any public acknowledgement that Biden displays multiple symptoms of Parkinsonism, and I will get into what those are. I am not claiming that I know for sure he has it, but it seems a very reasonable explanation based on the material evidence. And one of the most difficult parts, I can say that Trump's excessive falsehoods, and they were excessive again, are consistent with narcissism or other personality traits. The challenge there is that we need to know what his motivation for those statements are, and we will get into that in the discussion. So again, I'm trying to put all this into the context of how, as a psychiatrist, I know these things or don't know them, and I will get into the ethics of why it's okay to be discussing them publicly. And I will be trying to make it clear during this discussion, separate out what I know, what I can say as a fact, what's an observation, what is an assessment that I don't have any other valid hypotheses or explanations for. And there are points, particularly when I'm making suggestions about what I think we should do ethically or changing ethic rules. I will try to make it clear that those are opinions. And I do have my own political biases, and I am aware of those, and I won't be trying to keep them in check. And I'm aware that all my viewers do not agree with those. So to launch into it, many of Biden's defenders have sort of dismissed his appearance during the fumbling, confused, incoherent at times, 90-minute appearance as just a one-off, just a bad day. But again, this was not a pop quiz. This was, so to speak, and pardon the pun, a midterm exam. He was foretold in advance. He had warning. He had time to prepare. He acceded to doing it at late night, 9 p.m. On a weekday, and agreed to it. And he had his aides and presumably his doctors on board, helping to supposedly put him in the best condition he could be for this performance. And by virtually everyone's consensus, he performed terribly. So one question that comes up at the top, both of these men are clearly 4 years older than they were 4 years ago. That is an undisputable fact. However, both of them are showing changes in verbal fluency, at least not just in this 90-minute debate, but there are multiple instances for both of these men where their verbal fluency has their choice of words, their confusion with words, or saying the wrong words, mispronouncing words, is more deteriorated than we would expect from a normal, healthy person aging in 4 years. Particularly Johns Hopkins University psychologist Guy Gardner has documented some of the changes in Trump's speech. So some of this is just word-finding difficulties. All of us do that some of the time. Just last week, I said sertraline about 4 times when I was trying to say serotonin. Trump misspoke the name of his doctor that supposedly administered a mental status exam several years back as Ronnie Johnson rather than Jackson. But I would point out that among the examples, there are multiple examples of Trump, not during this debate, but in the context of the last several months, not just confusing names, not just misspeaking words, but actually struggling to create a real word, not just substituting one word for another and creating new words. There's also multiple examples of him clearly confusing the identity of the individuals, and that is a categorically different issue than just calling someone by the wrong name. So he went on at length about confusion between Nikki Haley and Nancy Pelosi, and again, it doesn't make sense even as a simple name substitution. He was clearly getting confused about the role of different people in his life. Now, one of the themes of today is, can we attribute that to dementia? It would be consistent with dementia, but if you accept, and again, I think the evidence is irrefutable that Trump has ADHD, is it he's just not paying attention to what he's saying? Is he just blurting things out? Is he just careless with his words? Or is it narcissism, that he just doesn't really care whether he gets someone's name right or other? So there may be multiple explanations for some of this deterioration. So a definition or a diagnosis of dementia requires a decline from someone's baseline. Both of these men seem to be declining, and it actually requires impairment in functioning, measurable impairment. I would argue that even if their defenders still defend them, both of them are showing impairment as determined by people who are open-minded or undecided about the election, think that both of them don't present as being in their right full charge of their faculties. So that is a functional impairment, whether they think they're impaired, whether their followers think they're impaired, and whether or not they can execute the duties. They are displaying enough language problems that indicate that they may not be able to, and that itself is a functional problem. So how else do we diagnose dementia? So one important distinction, others have made this point before, there's a big difference between screening tools such as the MoCA, the Montreal Cognitive Assessment, and the Mini Mental State Exam, MM3. Both of those are 30-point screening tests. So they are administered when someone is suspected that they may have dementia or a dementing process. They're not a definitive test to determine that that's what's going on. They are, if you score lowly enough or a low enough score, that is an indication to do more study and more evaluation. If you score well, then that may be moderately reassuring. So Trump in 2018 supposedly took the MoCA, and this was so famous it became a meme for t-shirts. Person, man, woman, camera, TV. He claimed that this was the hard part of the test, and he remembered all 5 words, and he remembered them in the proper order, and that supposedly was an exemplary performance. Well, one to begin with, again, this is a screening test. This is not an intelligence test or a scale used to measure how good your memory is. It's just to detect impairments in memory, and 30 is the maximal anyone can score. There's not extra points for doing it faster, there's a ceiling effect. So if someone told him, and he claims someone told him that he did the best they've ever seen on this test, that person was either incompetent or lying to him or both. And furthermore, And I haven't seen anyone else making a point of this, but this is critically important. The 30 questions or 30 points on the MOCA depend on giving someone a valid test or asking the questions the proper way, the right sequence. This is a standardized, validated test. The 5 words in the original form of the MOCA were face, velvet, church, daisy, red. They were not person, man, woman, camera, TV. The whole point of those 5 words is that they're supposed to be independent, not linked, not closely connected, not obviously pick up one and you're going to generate the whole list. Whereas Trump's list, person, man, woman, camera, TV, and he's repeated that, he insists those were the actual words that were given to him. Either he forgot right away and those weren't the words at all, or equally possibly, maybe more likely, the person who administered the test had no idea who is Ronnie Jackson, had no idea what they were doing and just threw out 5 words, but it's an invalid test. If you ask someone to remember person, man, woman, camera, TV, that is a much easier, simpler task than 5 random words. So, and similarly, like the mini mental state exam is a 30-point test. There's only 3 words there to repeat or recall. Some of the other questions on these exams refer to orientation, knowing where you are, what's going on. Can you follow simple directions? Can you read or write? Can you make some simple drawings? Again, these are not tests you can ace. Normal adults are expected to perform close to 30 points on all of these. And again, so whoever administered Donald's test to him either lied about the results or didn't administer it directly. If someone on a screening test there's indication that there are problems, then usually more sophisticated neuropsychological testing is performed, and these tests usually take hours, and someone goes through a battery of specific tests, checking working memory, checking long-term memory, checking attention, checking impulse control, checking a whole range of other cognitive functions. And sometimes if the impairment is enough, the low scores on those can be helpful in indicating what's going on. Often it's most helpful as a baseline to establish, as time goes on, are there specific decrements in what's going on? Now, currently, dementia is actually a rule-out diagnosis. You have to rule out, is this mental status changes due to thyroid problems or B12 deficiencies or head trauma or other processes going on. The definitive way of determining dementia is, again, functional impairment decreased from baseline, poor scores on neuropsychological testing, and we do have brain imaging that can be supportive and strongly indicative of diagnosis. So PET scans, specifically looking for beta amyloid and tau tangles. If it's far enough along, there may be gross anatomic changes detected on MRI. There are spinal fluid tests available for beta amyloid and tau tangles. And possibly as soon as weeks away, or maybe months or years away, there are blood tests that will be able to, with a high degree of likelihood, reveal who is in the early stages and probably even decades before someone is manifesting Alzheimer's disease. Those are not commercially available yet. They're available if you're in a study working on examining Alzheimer and other dementia processes. So we don't have a brain biopsy on either gentleman. I don't know if PET scans have been done. I cannot definitively say either of them have dementia. In addition to the neurologic, biological, physical health problems, there's also, and this is really important to point out, considerable overlap with psychological processes. So there's what used to be called pseudo-dementia with people who, a subset of demented or depressed people who had such pervasive impairment in their cognitive functionings that it looked like dementia. However, if you treated the depression, either with therapy, which is usually difficult if they're that pseudo-demented, or with medications, or with ECT, very often depression resolved completely, and there was no cognitive deficits existing, so it was not a real dementia. And really important for both of these men is the huge overlap between ADHD and dementia. We sort of simplistically pose dementia as a memory problem over here, ADHD is an attention problem over here, but there is huge symptomatic overlap, and even those specific domains show significant overlap. If you're not paying attention, you're not registering, you're not encoding the information you're trying to remember. So I can't say that either man is demented. I can say both of them are showing some signs that are compatible and could be due to that. So I'm going to jump to ADHD next. I'm going to try to race through this a little more quickly. So I've written a whole book about it. It's out there. So how do we make an ADHD diagnosis? So the gold standard is a clinical evaluation by someone experienced with it. I have 30 years of evaluating and treating adults with ADHD. I've written a book on recognizing ADHD. So I feel very comfortable, not that I cannot be definitive in every single individual case, but some cases are blatant and obvious. So ADHD has to appear symptoms before the age of 12. The symptoms have to be pervasive in multiple settings, and they have to be excessive for that person's age and cultural background. And I would suggest that any politician who gets the two-word phrase gaffe prone associated with their name, we should be asking questions whether they have ADHD, because by definition, the politician's job is to be smooth, convincing, mistake-free, at least traditionally, historically. If they're prone to making lots of mistakes, there could be other reasons, but ADHD is something that should come up. So for ADHD in an adult, we only need 5 of the following symptoms. 9 are inattentive symptoms, 9 are hyperactive impulsive, and Donald Trump robustly, unquestionably meets criteria for almost every one of these points. Biden meets several of them, and I will signal out which ones I think Biden clearly also makes. Whether he meets more of these criteria or not, I'm going to be agnostic on right now. So inattentives, fails to attend to details or makes careless mistakes. Biden, Trump, both have a history of doing that repeatedly. In fact, Biden's, one of his earlier runs for presidency was derailed by he failed to attribute a part of his speech about being a coal miner's son to Neil Kinnock, I believe, a British politician. In numerous times when Biden had shared that anecdote before, earlier on in the campaign, he had properly attributed it. He was clearly not suddenly trying to hide and pretend that this was his own life experience. He clearly made a careless, stupid mistake. I'd say any other interpretation is, I'd say, highly suspect or biased. So anyway, both of them make mistakes. Difficulty sustaining attention on tasks. Trump's notorious for that. Does not listen when spoken to directly. Virtually anyone who's worked with Trump on his inner circle of aides, advisors, his cabinet has attested to that. Does not follow through on instructions or plans. Again, Trump excessively demonstrates that. That doesn't mean on some issues, like when he had particular interest in buying a certain property, he could perseverate on them, but consistently didn't follow through. Did he even try to collect from Mexico on the border wall, despite talking about it over and over? Difficulty organizing tasks and poor time management. Again, this is one that Biden has also displayed. There's reports when he was in law school and elsewhere, how he often waited to the last minute to study. He actually did get around to studying, but poor time management. Avoids engaging in tasks requiring sustained effort or homework. Who boasted of not even practicing or preparing for the debates this time and 4 years ago. And for someone who wants to be seen as a stable genius, actually having some facts might have been useful to Trump. So loses items. I don't have evidence that either of them do this. I just don't know. We're not as privy to that part of their lives. Often distracted by extraneous stimuli. I would say that both men have done that during, getting involved in a discussion about someone, a golf competition in the midst of a debate. about public policy and your own competency to be president. I don't see an argument about golf is that relevant. And, Biden is less successful both this time and 4 years ago at not getting sucked into extraneous stimuli, responding to people out there. But Trump to a greater extent, and often forgetful in daily activities. Both men have history of that. In terms of hyperactive impulsive symptoms, fidgeting, tapping hands and feet, squirming, virtually every debate except when he's taking stimulants, that's how Trump presents. Leaving your seat when sitting is expected, or walking around feeling restless, how many pictures, photo ops is Trump wandering out of the picture? And again, his narcissistic traits make him want to be the center of the picture and the standout there. He's not even acting in his own professed self-interest there. Unable to play quietly, that one I don't know whether either candidate for presidency right now qualifies for that. On the go, driven by a motor, again, Biden riding his bike at 80, also, both of them, despite claims by the other side, do display an ongoing desire or need, at least for significant bouts of the day, to be active, on the go, driven. Talks excessively. This is, again, one that Trump clearly qualifies for, and Biden does as well. When he was in the Senate, he was known as a bloviator, just going on, blurting out answers. Again, that ties back into being gaffe-prone. Both of them have certainly made numerous statements in excess of what other politicians do that seemed either not fitting at the moment or not fitting at any company or present situation. Difficulty waiting turn and interrupting, intruding on others. We have in the multi-person debates 4 years ago, particularly Trump excessively intruded on others. Is that potentially part of narcissism as well? Potentially, but the ADHD diagnosis is driven by these being behaviors. The motivation for why someone is doing that is separate from the ADHD, is not a part of ADHD. So if someone's doing that, so Trump meets at least 13 out of 16, Biden meets more than 18. Biden meets at least 5 of these 18. By the definition, and there's certainly people who don't accept that ADHD exists or is a thing, but if you accept that this is how we define it, this is a meaningful construct, which I do, I think the fact is compelling that both men are on the ADHD spectrum. I would say Trump is certainly farther along. And I should point out that there are certain positive aspects to ADHD in a politician. So one is candor. If you're speaking what you are thinking, that, at least in some subset of the population, comes across as, I can trust this person, he's not hiding something from me. I think there is a huge confusion and blurring between candor and honesty. So you can blurt out what you're thinking, you can tell us what's true in your mind, but that doesn't mean it is true in reality, and there is ways to assess objective reality. Second area that politicians with ADHD may excel is thinking outside of the box, thinking of novel approaches to problems or situations. And third is having a certain enthusiasm for their passions and being able to convey that to others. So and I'll get back to the end, ADHD, I don't think should be a criteria for ruling out someone as a candidate for office. So some of the things, again, some of these symptoms I've listed, could dementia be contributing to some of them? Yes, but they've been existing for both men for decades. Are they more relevant or more prevalent right now? Yes, some of them are. Again, could narcissism explain some of them? Some of them, but again, it certainly can't explain all of them. Could Joe Biden's well-documented stuttering issue, could that explain some of his speech patterns, some of his blurting out? Some of it, yes, it doesn't explain, bloviating and going on and talking at length. Could the Parkinson's explain some of it? Possibly. So again, I could say with certainty, by our current criteria, both men have ADHD. So I was interviewed by David Pacman. There have been more than 460,000 people have seen the video discussing Donald Trump's stimulant use. This was done just before the interview, but he displayed the 3 signs that I've said to watch out for as evidence of it. So I measured certain behaviors and performances, and this data goes back to Trump's third debate with Hillary Clinton 8 years ago, when after the first 2 debates, people said he doesn't even seem to be really interested in this. He's rambling, he's discursive, he's didn't prepare, he's not ready, and that he needs to show that he's presidential for the third debate. In that third debate, observers said, whether or not they like the content of what he said, he's more coherent, looks plausible as a leader. And if you look at that third debate, or you look at this most recent debate, or you look at certain State of the Union speeches or other important speeches he gave, and you contrast that to his other performances that very week, there are 3 noticeable, really detectable, huge differences. One is reduced movements. When he's talking in other settings, he is moving close to a movement a second. Shifting body position, hands gesturing, head bobbing, head shaking, pursing his lips. When he's on stimulant medication, and stimulant medication with someone with ADHD will do this, he's moving around only about 1/3 as much, a huge difference. Now, could that just be solely from voluntarily focusing on it? Possibly. But simultaneously, there's what I call increased coherence. So separate from the truthfulness, the veracity, the reality-basedness of his statements, does one sentence follow another sentence? Is there any logical connection to a outside listener outside of his brain? And in his other presentations, coherence is as low as about 60%. For most politicians, it's upwards of 90%. In his instances when he's taking stimulants, his speech is much more coherent in the high 80%. So a marked increase in coherence. Now again, someone with ADHD, if they're focusing on that part of their behavior, may improve, but it's almost unheard of for someone to simultaneously be able to reduce their movements, because if you're focusing on that, you're less aware of your speech and less in control of it. Or if you're controlling your speech, your movements aren't going to be going in a good or more controlled direction. So that in itself is fairly compelling. But the kicker or third point is that during these times, his pupils are substantially dilated. If you look at the debates where the 2 men are under similar lighting, comparing them to Biden, Trump's are much larger than Biden's. If you compare Trump to himself, other speeches that same week, his pupils are small, and particularly his pupils are large and he's squinting more than usual. That's a sign that, so your pupil is supposed to change size in accordance with how much light there is. It should get smaller. If you are squinting and your pupils are big, that's strongly indicative that something is causing your pupils to be dilated more than is appropriate for the lighting condition right there. So other things besides lighting that can change pupil size is emotion count. Someone excited, someone scared, someone trying to focus really intently. But those changes are changes on the order of a few seconds. Throughout the entire debate, Trump's pupils are dilated. And there's certain brain damage and other things that can cause dilated pupils. But again, he is showing pupils dilated for hours at a time, and that they're not dilated within a day or 2 afterwards. The only class of medication that does that are stimulant medications. We can say with certainty Trump is taking stimulant medications certain times and not consistently taking this. Doesn't tell us what he's taking, doesn't tell us whether it's a prescription medicine, doesn't tell us whether he has a legitimate prescription for it or not. But we should actually be encouraging him to take it more often, because for someone with ADHD, he is less impulsive, more coherent, more organized, more effective as a person when he's taking it. So jumping over to Parkinsonism. So I am not a neurologist, but partly because I was willing to work with Medicare patients, I've always had a large segment of elderly patients in my population. There's not a work week in the past 30 years where I have not seen at least one Parkinson patient. So I've had numerous patients with Parkinsonism that I worked with over decades. Psychiatrists do have some training in neurology beyond what general medical doctors do. I'm not pretending it's the same as a neurologist. I'm not pretending I am a neurologist, but so what are the criteria for Parkinsonism? The official criteria are actually pretty simple outline. Bradykinesia, which is slow movements, plus one or the other of tremor or rigidity. That's it. Now, so that's it, the core definition of Parkinsonism. Usually a physical exam is helpful to help evaluate in more detail. So to check for, is the rigidity a pattern called cogwheeling, where there's resistance and then lack of resistance at different states. To examine postural instability, which is a characteristic of Parkinson's. So I'll go through the symptoms that I observed during the debate that Joe Biden did not have 4 years ago. So one, a shuffling gait. And it's not just shuffling gait, it's hard to start, then he goes with small steps, and he does speed up a little as it goes along. That is called a festinating gait. Festinating. That is a classic symptom of Parkinsonism. Now, his aides have said, oh, yeah, his gait, he has spinal arthritis. That explains it. The guy doesn't appear to be in any pain when he's walking this way. Could he also have spinal arthritis? He could, but that doesn't seem to be a good match for actually what we are seeing. Second symptom, what's called masked face or masked faces in official neurologic terminology. During this debate, there was very little facial expression, even when he was getting emotional, even when he looked frozen. About the only facial expression he succeeded in conveying was sort of dazed confusion at different times. Again, the bradykinesia slow movements and include frozen movements for Parkinsonism. A masked face is classic for it. Can there be a few other conditions that cause it? Yes. But again, shuffling gait and masked face together, strongly suggestive. Now speech, and I knew that, so I actually went to the Parkinson organization speech, and this is their definition said, hoarseness, having a low volume, trouble starting with speech, may speed up as it gets going, and ending in mumbles. That is almost a perfect description of Biden's speech patterns during the debate. Now, his hoarseness was dismissed as he had a recent cold. I did not detect a single cough during that whole 90-minute debate. There might have been one or two. I didn't detect them. That doesn't fly. Yes, you can be hoarse after a cold, but most people are still coughing if that's the source of it. Some people have also brought up his stuttering. Yes, that could contribute to starting sentences, but again, this is a marked deviation from his own appearances, his own presentation. Here's neurological presentation. Now, one thing, and I should preface all of this maybe that most of my news I get by reading. I did watch the debates. I don't watch much other news. I did not see whether he had a tremor or not. And with Parkinson's, what's classic is what's called a resting tremor. So hand is shaking when it's sitting there, but if you're doing a task, and finger to nose is one of them, it's usually pretty steady. It's not missing the nose. It's not a movement tremor. In fact, there's sort of case studies of famous surgeons who develop Parkinson's who are tremoring at rest, but then when they're using their scalpel, this is the old days, could execute their movements safely and securely and reliably because their movement during an action wasn't affected. So one thing I should note, though, both men, not just in this debate, but if you go back 4 years, 8 years when they're debating crowded fields of people. So when Biden had 6 or 7 Democratic competitors, he was the only one holding onto his podium most of the time. Now, that's a good way to hide a Parkinsonian tremor. It's also a good way to hide ADHD hyperactivity. And in the Republican debates of, again, 8 years ago when Trump showed up and there were multiple competitors and multiple people to compare him to, he was, again, the only Republican who was pretty steadfastly clinging to his podium and holding it. Could they both have balance problems? Could they have other reasons? Could it just be a pattern they developed? Possibly, but I think both men, either consciously or unconsciously, were doing it to not reveal hyperactivity. So it's an evidence that Biden has something, and if he does, I mean, it could also explain, if he does, particularly if it's being treated, why these symptoms do vary day to day, and might have been more present late at night. Could there be other explanations? It's possible. I've talked with a neurologist friend who hasn't been able to come up with anything else that he thinks is even remotely likely. So the last thing before I jump into ethics, and I know this is going longer than I expected, personality disorders. So whether, again, you like the guy or not, verifiably, he lied way more than Biden did during that 90-minute debate, way more than rival Republicans for when they were vying for the nomination lied in their debates, way more. So is that a sign of narcissism? Is it a sign of his personality disorder? I mean, so one thing, and I've talked about this before, there's differences between reflective lies, where you think and intend, you're intentionally trying to deceive your audience and know you're misleading them. There are reflexive lies where someone, and this is really common in ADHD, gets caught doing something bad or wrong and just makes up an excuse in the moment, often not even believing it themselves, particularly not believing it themselves or believing that others will really believe it, but it's a way to deflect blame. And there's simple, what I would call falsehoods. They're just rambling statements. So when I believe when Trump suggested injecting bleach or certain light might get rid of the coronavirus, he was not advocating, he didn't, when he wants his followers to do something, he speaks in simple declarative 3-word sentences. Lock her up, something like that. He was not ordering a command or a suggestion. He was just riffing off the top of his head. And again, it was inaccurate, but that doesn't make it a lie. Also, a difficulty in diagnosing it. Again, there's a huge overlap between ADHD symptoms and possible narcissism. And for making a personality disorder diagnosis, we need to know what his motivation is, why he's doing it. And the further fact is that Trump has been rewarded by his behavior. So some of it is that he's just gotten reinforcements. He can blurt out what he wants. He can say untruth after untruth. If he says it emphatically, then he has many followers. He gets rewarded for doing it that way. There are some studies, and I'll get them to the next section, which is the ethics, where personality disorders can be fairly accurately diagnosed via video. So people's observations do line up with other ways of assessing personality disorders. I think he seems to display a large number of narcissistic traits. Again, how relatively important that is to ADHD or to dementia, I don't know. So moving on to ethics, and I'll again try to speak quickly. So the Goldwater rule is the ethics rule, it's not a law, of the American Psychiatric Association, that no public statement should be made in public, no public statement about a public official without their in-person evaluation and the person's consent. So by that rule, it seems like I'm doing something wrong or unethical. So I'm going to deal with the consent part first. If we are relying totally on information that's in the public domain, there's no issue of confidentiality. We haven't betrayed anyone's confidence. We haven't leaked any information that isn't out there, and I am using information from public domain. So his consent is irrelevant. Second is that this whole ethical provision relies on an untruth. And I would argue that you cannot have an ethical rule or precept that is based on a falsehood. The falsehood is that the gold standard, the best way, a certain way to make a diagnosis is with an in-person evaluation. And it's been repeatedly studied. In-person evaluations, particularly without a structured interview, and even with them, but they have some validity, there's some consistency, but there's a lot of slop, there's a lot of disagreement, even by experts when they're evaluating someone. So in-person evaluations don't have particularly high validity, and there is a growing body of evidence that watching video clips, watching someone's behavior has validity, consistency, person evaluator to evaluator, and consistency between an observer video related evaluation compared to what the person's describing about their own personality or close confidence are. The validity of videos is probably just as good as an in-person evaluation. So if that's true, and again, the evidence so far suggests that the whole rule is meaningless. So the other points that I'm going to make increasingly, and this is clearly kickstarted by, we had video sessions pre-COVID, less than 1% nationwide of health visits were by video. During COVID, that shot up hugely. For many other specialties, the numbers dropped back down significantly, but the most recent survey suggests that more than a third, something like 37% of mental health visits are now done by video. And that includes initial evaluations of mental health conditions. So we really want to be in a position of saying that a third of what we're doing is garbage and meaningless because it wasn't an in-person one-on-one interview? I don't think so. And furthermore, I would argue that particularly for famous individuals like Trump and Biden, the video documentation is so far superior to a one-on-one interview evaluation in your office. So orders of magnitude more data, hours of video of watching them interact, way more than you can get in initial evaluation or even after years of evaluating a single patient. 2, we're seeing these individuals in a variety of different settings rather than just sitting there in your office. That gives you a greater breadth of information. 3, they're interacting with more people. It's not just a one-on-one interaction with you. We can see them interact with their peers. We can see them interact with their underlings. We can see them interact with their opponents. Again, much broader wealth of information that's diagnostically significant. 4, we're seeing them across a broader range of times of day. You see someone early morning, there's video there. You see them middle of the day, you see them late at night. In your office, you're probably only seeing them at a certain point in the day. 5, the videos provide historical comparisons that isn't marred by personal recall. Someone can tell you, I was never rambling on and on like that 10 years ago. But if you have video of what they did 10 years ago and video of what they're doing now, you can make direct historical comparisons. 6, the video allows actual measurement of movements, of facial expressions, of voice that you don't usually have unless you're asking your in-person evaluation subject, can I tape you and look at what you're doing movement-wise? We don't routinely do that. And 7, the fact that in an interview setting, clearly if you said, Donald Trump, you need to go in there for an evaluation for dementia, or for ADHD, or for narcissistic personality disorder, he or most people are going to be playing to the evaluator. They're going to be trying to present their best features or best image with the video evidence. Some of it's scripted, some of it's out there for a specific audience or designed for it, but many of them are more spontaneous and again, not tailored to a evaluation setting and therefore more informative. Now, there's at least one major downside to making an assessment with videos. One is that you can't ask direct questions. What I would argue is that for ADHD, for Parkinson's, that's not particularly relevant. ADHD, again, the criteria are written purely as behavioral criteria. You can argue whether they're good criteria or not, but that's how they're written. And again, being able to ask why he did it or was he aware that he did it isn't particularly useful information. So I'd say our primary ethical obligation as doctors is to our patients, but most ethicists have conceded that doctors also have some ethical obligations to change society for the better. This is why and this is particularly true in psychiatry, where we know the environment, where we know the family environment, the general world environment, social factors, biological factors, have an influence on the development of our conditions. And it's interesting, the APA, the American Psychiatric Association itself, engages in lobbying, engages in politics, engages in trying to change legislation to influence political outcomes. So pretending doctors shouldn't be involved in the political process is directly counter to what the official organizations themselves are doing. And it's not just in terms of politics and lobbying. The APA is one of has a large PAC, Political Action Committee, that makes direct contributions to congressmen, and not just to congressmen, but they have a record of giving funding to people on both sides of the aisle, but that includes people of one political party who explicitly continued to voice opposition to APA official policies. So opposition to gun control, opposition to LGBTQ non-discrimination. For a psychiatric organization to be condemning intervening in the political process when they consistently and fundamentally have done that just seems inconsistent. So the other thing I would argue is that it's in a democracy where peoples are choosing their leaders. I would say it is unethical for people with expertise or knowledge in a certain area to abandon the discussion to those who are ignorant or are operating on purely partisan values. We have an obligation to share what we know. So, and I'm almost wrapping it up. So what I think is ethical rather than the Goldwater rule is, one, being transparent, describing the criteria we're using for when we suspect someone's doing something, describe the evidence that we feel meets that criteria, and describing our degree of certainty in that assessment. I've tried to do that today. I think there should also be, and these again are feelings, opinions, transparency on the political candidates. I think we should have health information that's important about our candidates. I think in the long run, that actually reduces stigma. I think if FDR was out there rolling around in his wheelchair more often, being in a wheelchair would have been destigmatized more extensively at an early time. It's sort of ironic that to be in the US military, to be the lowliest grunt of grunts or the raw recruit, there are more than 60 conditions. If you have them, you're just disqualified. You can't enlist. The commander-in-chief, who's head of all of our military, there is no evaluation for that. And if we look specifically at ADHD, the military is really weird on this one. You can have ADHD, that isn't an automatic disqualification. But if you're taking stimulants for it, if you're actually treating it to be more effective and reduce it, that is a reason for automatic disqualification from the military. And again, I think it's backwards. I think we should be encouraging Trump, if he gets into any office again, to take his stimulants every day because he becomes less impulsive and more rational and organized. And I would say in this last little bit that I don't believe we should have automatic rule-outs for any of these conditions. So I think people should be taking that as an important piece of information, but I don't think we should have an age cutoff. The gentlemen we've been talking about now in their very early 80s are showing signs of problems. Age itself is a risk factor for dementia. It's a contributor to dementia, but there are plenty of 80-year-olds and even 90-year-olds and 100-year-olds who are perfectly in control of their mind. Age should again be a flag saying, look at this, pay attention, but it shouldn't be a rule-out. Again, ADHD has positive attributes, it has negative attributes. We should be aware of it if a candidate is meeting criteria for it, so we can better interpret some of what they're doing. And that, you may decide you don't want a leader that to you isn't indicative of a leader. I think Biden's team should be straightforward about whether he has Parkinson's disease or not. Again, I don't think that should be a disqualification. And I'm even going to move into the dementia realm. I don't think dementia itself should be an automatic disqualification. And partly why I'm saying that, and yes, technically right now, dementia is the stages where you are showing impairment, but we have a pre-dementia category called mild cognitive impairment, where you're slipping a little bit, but you're basically functioning. But all the evidence for Alzheimer's, and I think very soon we will have blood tests, which are going to be all the evidence so far indicates are highly indicative of, we may be able to know 30, 40 years before someone develops florid signs of impairment that they have Alzheimer's dementia, even though they're not manifesting it. So where do you draw the line? Again, I don't think having that in itself is a rule out. I think it's the degree of impairment is what we should be looking at. So thanks for sticking with me so long. I'm sorry I talked so much, and I see a lot of questions. So I'm going to jump to that. Next week's topic is back more to my more regular discussions. So I'll be talking about L-theanine and ADHD. So, and I'm going to try to shift the screen so I'm not looking sideways. So Herman Musimbi said, would you ever consider discussing schizophrenia or the overlap of dementia with psychosis? And he mentioned some new drug that's been approved by the FDA for this condition. I'll say, yeah, it's potentially a topic I would talk about. And Avatar of Justice mentions mild cognitive impairment. Ernie asks, ADHD is subjective to definition, isn't it? So I would say yes and no. So what I mean by that is, can someone subjectively think, oh, this is a standard and this person looks like they are moving around the room than other people? Yes, it can be interpreted subjectively, but as written is actually objective, and you can do a survey, you can study how much do 50 kindergartners run around during the session. And if 2 of them are running around 45 minutes each hour and all the other kids are sitting there, you have an objective, that the criteria are actually not written subjectively. Subjectively accept what's excessive, but again, excessive you can measure. And things like interrupting others during the Republican debates of, again, 8 years ago, there was good data. Trump is interrupting people much more than others. So that's where I'll address the subject. And again, I'd say other mental health conditions are far more subjective because we are required to know what is motivating people. So Dennis asks, in theory, could ADHD be diagnosed with a brain biopsy? And the simple answer is not at this point in time. So at a group level, we are seeing differences between, let's say, activation in certain parts of the frontal cortex with certain tasks. We are seeing maybe greater density of dopamine receptors in certain areas. But the range of, part of why we do not have any single biological marker is that we are talking about group averages. So people with ADHD score higher or show this average value here, which is different than a non-ADHD population. But within both groups, there's considerable range of whatever that dopamine levels in certain parts of the brain, activation of a certain brain region, connectivity of a certain brain region. There's so much overlap that you can't look at a certain point and say, oh, that individual clearly has it. So it's just like, do I believe that we have more than 2 genders? Yes, but many people are largely female and largely male and largely self-identify that way. Yes. Are there some average differences in brains between them? Yes. Or height or weight? Yes. But can you look at someone's height and say, oh, I know that's a guy and that's a girl? Or look at the brain structure and say, no, you can't. So again, the fact that we see observable differences at a group level doesn't mean that they're useful diagnostic tools. So some of these questions are, I'm trying to avoid the political ones about which party has lost all credibility, but I do think it ironic that someone's worried about the credibility of one party when the other party observably and consistently has ignored reality. And some of these questions, I'm not sure exactly what comment they're referring to. So how does that differ from Alzheimer's or dementia? So more political discussion. I wouldn't necessarily say Trump lied, but exaggerated. No, that's simply, some of his statements were exaggerations. Some of them were flat out lies, and demonstrably, repeatedly, and extremely frequently. So it's not, I mean, it's hyperbolic when you're saying you are the best, but if you're saying you built a wonderful economy, I mean, Trump inherited 7 years of an Obama recovery, a positive, strong, robust economy. If you look at a chart of unemployment, if you look at gross domestic product, if you look at the stock market and don't have the years label on it, ask someone who claims that Trump created a wonderful economy and try to get them to pinpoint where did Trump's policies change this line. All of those lines show an ongoing, whether it's unemployment going down, others going up. You know, there are month-to-month fluctuations, but there is no improvement in any of those. There is no improvement after Trump's massive tax cut. Even the economists who favored and supported and encouraged it have acknowledged they didn't see any meaningful impact of the economy on the tax cut. So the claim is beyond just hyperbolic that he created a wonderful economy and that it has been destroyed by Biden. So what's the worst or most debilitating mental health condition in your opinion? Could you cite some patient experiences? I think schizophrenia is probably the worst. One is that there are many individuals with schizophrenia who are so out of touch with reality that they aren't aware of their own, how differently they think, how out of touch with what we consider mainstream reality. So would I want myself to have schizophrenia or anyone I love to have it? Absolutely not. In my mind, dementia is one of the worst. I mean, I guess maybe it's saving grace as it tends to be at the end of life. So at least you've gotten years or decades in. But for most people, there's some awareness that they are losing it. I mean, and another way of measuring it, you could see which mental health condition has the highest rate of suicide, because maybe that's the best measure of despair and or self-assessment of how horrible it is. Although, again, even there, as I've pointed out in other talks, ADHD actually has a fairly high rate, but some of that I think is more, I think the evidence is overwhelming, is tied to impulsivity as well as despair. So I guess I don't think it's a particularly useful practice. It's also, I think I have a talk on it. I've certainly written about it, why I strongly dislike the term serious mental illness to refer to schizophrenia and bipolar and sometimes psychotic depression, sometimes even major depression, but almost universally omits ADHD as a serious mental illness. I mean, the term itself is appalling, unless you think some of these are funny mental illnesses or some of them are trivial mental illnesses. They're, again, I think are conditions that can be horribly impairing, horribly cause suffering. So the Hippocratic Oath is do no harm. So speaking the truth, I think is consistent with do no harm. So Modima suggests, how about a compulsory evaluation for basic cognitive functioning? Again, We have batteries of tests. I don't know that we have a single simple exam, but I would actually favor both a physical exam with criteria written ahead of time and a mental health exam, cognitive exam, with criteria discussed ahead of time, consistent for all candidates, and that they are subject, that they don't get on the ballot unless they comply with that. Now, there may be First Amendment and other rights people would complain to, but it is a privilege to be a leader in a democracy. It's not a right. You shouldn't have the right. I mean, that the democracy should have the right to put restrictions. I mean, we already do with age. We say you have to be at least 35. Are there 34-year-olds who would clearly be competent and able? Absolutely. Are there most 10-year-olds who wouldn't be? Probably. So is age relevant? Sure, it's relevant. But again, we already have some compulsory criteria. I don't have a problem with increasing the number of criteria we have and requiring that as a condition for getting on the ballot. So Trump has said he's had two he has not had, he has strongly denied that he has had any intensive cognitive neuropsychological testing. The only things he has ever described are 30-question tests, which are screening tools. This is, again, he might call them tests, but that is, no, he is not. That's simply not true. So what is the military's justification for the rule allowing ADHD folks only if not taking stimulants? One is, I'm not sure how, I mean, there's a joke about military intelligence being an oxymoron. I won't lean into that one too strongly. I mean, their job is to have people who are ready at all hours of day and night to be prepared to kill people. That's their job as the military. That's maybe a little harsh. So they don't want conditions where someone could be in the field, like a diabetic, and they don't have access to their insulin, and they go into a shock or coma or are disabled and then become a burden on our own troops to take care of them rather than being able to fight and kill their adversary. So I think some of the assumption, their assumption, and this is speaking for them, is that, ADHD, maybe this is more thought than they put into it. If it's mild, if you're not taking medicines, maybe isn't really impairing you. But if it's bad enough that you need to take stimulants or you're dependent on stimulants, then one, it's really must be impairing. And two, if you're deprived of your stimulants, then you can be dysfunctional. I mean, it's interesting that one of the biggest users of stimulants has been historically the military to keep people awake 24/7, to kill other people, and that at least in the Afghanistan wars, some of the collateral damages where we dropped bombs on 10 or a dozen Canadian fighters and killed them have been attributed to the fighter pilot being jacked up on stimulants and not making good decisions, maybe sleep deprivation as well. So I'm not saying that policy makes a lot of sense, but I think there's some thinking behind it. So I don't know if there are more. Okay, it's not sliding down at the moment. So the last, I do believe everything I stated as fact were facts, and the things I stated as opinions are opinions, and I do believe I behaved ethically in delivering this information, but you are certainly welcome to your own opinions. You're not welcome to your own facts. That's all. Stay safe, stay healthy, and I'll be back next week.